Velkommen indenfor til jer alle sammen derude. Både jer, der ser med live, og vi sender til både YouTube, vi sender til Facebook og via vores egen hjemmeside. Og også velkommen til jer, der ser det her forskudt. Det er jo sådan, at vi både kan se tingene lige nu og her, men vi også gerne vil have jer med i løbet af den næste uge eller 14 dage, eller som I nu har lyst til at lære Spermosens at kende, som jo er det selskab, vi skal koncentrere os om i dag. Vi har et format her i Dansk Aktionærforening, som vi kalder Meet the Company. Det gør vi i hvert fald, når det er udenlandske selskaber, og i dag er det et svensk selskab, vi har med. Og her sætter vi fokus på et selskab, som er aktuelt med enten en halvårsrapport eller på anden måde er aktuelle derude. Og det er vores bud til jer for at lære selskaberne bedre at kende. Det er ikke en anbefaling til, at I skal handle, købe aktier, men alene en opfordring til at sætte jer ind i tingene, stille jer spørgsmål, og det kan I også gøre derude live nu her på vores YouTube-kanal i hvert fald, hvor I så kan gå ind og skrive jeres spørgsmål i chatten. Og jeg skal sørge for også, at der under neden efterfølgende vil være et link til selskabets hjemmeside. Så det er jo sådan lidt om formatet her, Meet the Company. Men i dag skal vi tale om et problem for mange, nemlig barnløshed. Og det er noget, som mange mennesker, omkring 15% af alle par, som jeg forstår det, oplever. Og Spermosens, som er et svensk selskab, jamen de har udviklet en teknologi til netop det. Og derfor har jeg inviteret dig, John Lampert. Du er CEO i Spermosens og oprindelig fra USA.
Jeg er født i USA, men opvækst i Sverige.
Fantastisk. Og I har et team, der ligger i Sydsverige, altså i Lund.
Præcis.
Ja. Og jeg skal sige til jer, der sidder derude, at vi er inden længe går vi over til engelsk, men vi starter bare lige på dansk-svensk her i starten. Men jeg har tænkt mig at give ordet til dig, John, om lidt for en præsentation. Og then we transfer into English, and maybe we can already start now because I would like a little bit of warm up with you.
Okay, let's go. I'm ready.
So if I say, how are you? Then you say,
I'm good, thank you very much.
And who are you?
Good question.
Yeah.
Born in the US, raised in Sweden, studied law, also a dental technician. Been in the med tech business or life sciences all my life, more than 35 years. Living in Helsingborg, Sweden, raised in Malmö, as it was.
Okay.
And very happy to be here and meeting you again. It was great meeting you that while ago.
Yeah, but I was actually educated a lawyer as well, so
really?
I studied law, so we ended up different
we sure
places.
Did.
Yeah.
Life has its paths.
Exactly,
Yeah.
exactly.
Yeah.
And what about the purpose for you? What actually drove you into Spermosens in the sense that you actually thought this was something that you had to do?
Well, to summarize it in a way, I mean, I could say for myself it was that I really was looking forward to having a good challenge. And when I saw this opportunity, I saw that if this works, this is going to disrupt the market. This is going to go a long way. And I also was, and have always been driven by like succeeding with what I do and have a lot of passion for what I do. Because it's necessary to bring things from a seed into a finished product and bring it to the market. A lot of different elements are needed, and also a lot of passion and commitment is needed, most importantly.
So you were listed on Spotlight in May, and
Yes.
if you should explain to me or the audience in say 60 seconds what you do in Spermosens,
Okay.
what is it you do, just to take
We develop medical device products for male infertility. Male infertility has not been researched very much during the last 30, 40 years or ever actually. Female part, a lot, rightfully so. But sperm count has decreased by 50% in the Western males since the 1970s. A lot of factors have driven to the point where infertility is a global health issue. And we are developing products where it will be possible by diagnostics and further on treatment to improve the outcome, to be quicker and safer, if you will. That's what motivates me greatly.
So it's about fertility, it's about the men.
Yes.
That was the warm-up. So I'll now pass the word to you for a short presentation. And this is, of course, as you know out there, it's the company that has been listed. You recently gave your half-year report.
Yes.
And we'll now hear a little bit about the status, so to say.
I'll be happy to.
Yeah.
Thank you for having me.
The word is yours.
Okay, thank you so much. So, Spermosens develops medical device products for male infertility for individualizing IVF or in vitro fertilization treatments for quicker and safer results. And we were, as Mikael said, listed on Spotlight stock market under the name Sperm, May 5th. So today's presentation has basically three parts. One is Spermosens after being listed. Second one is part two, our long-term ambitions and goals. And the last part is what happened these first 6 months of 2021. So we had a successful market listing, that's sure. We listed at 5.63 crowns, and last Friday the share price was 22.40. So we're very happy for the support that we have received from the investors. We're very happy for the development which has gone so far exactly in line with our memorandum and our expectations. So we're very grateful, we're blessed. So moving forward, let's look at infertility. Yes, it is a global health issue, also according to the WHO. 15% of the global population in fertile age is affected by infertility. That means in numbers, 60 million couples, of which 50% does have a male factor. So to contradict this, so-called in vitro fertilization IVF treatments are done around the world. Actually, 3.2 million cycles. Unfortunately, 2.7 million cycles fail each year. So about 85% fail. Now, couples go through between 3 to 8 IVF cycles typically, but without any guarantee for success. So many go through without any success at all. Those who do get success go through an average of 2.7 so-called cycles to get fertilization and to get pregnant. And as I mentioned in the initial part when you asked me a few questions, there has been a 50% decrease in sperm count in Western European males since the 1970s, which doesn't make the situation any better. Now, our vision is to improve male fertility diagnostics and treatments by enabling a quicker and safer regimen and results. That's our vision. Our mission is to supply the male fertility medical device products leading to an improved workflow at the IVF clinics. This will enable an improved workflow and better results. And the goal is to establish Spermacens as a global market leader in male fertility diagnostics and treatments. And I truly believe that we have an absolute opportunity to do just that with the amazing technology we have at our hands. Now, today's practice when doing diagnostics on sperm is basically physical evaluation. There is no way today to determine the sperm's fertilization potential. Sperm is today evaluated from its physical properties, sperm count, morphology, and motility. We'll get back to that more precisely what that means. But normal-looking sperm does not mean a man is fertile. And sperm samples actually chosen without knowledge if there is a natural binding capacity between the sperm and the egg cell or not. Spermosens breakthrough technology and products, the first product being Juno checked, is expected to measure the binding capacity of sperm to the egg cell in less than 30 minutes. This is totally unique and totally novel. It's patented. We have a European patent, which I'll describe more in detail when we move forward. It's based on 2 independent research groups' finding of the newly found Juno protein, 2014 in mice and 2018 in humans. And it was found that the Juno protein was absolutely essential for male fertility. it's expected also that to enable the IVF clinicians to individualize the IVF treatments on the measured binding capacity found and to improve the workflow leading to faster and safer results. With other words, a sound measured basis for choosing which direction to go. Standard IVF based on a natural binding between the sperm and the oocyte, or ICSI, intracytoplasmic sperm injection, which is not relying on a natural binding. Rather, a sperm is chosen and injected into the oocyte by use of a micromanipulator. Now, this is how the sperm's properties are checked physically, which does not mean a man is fertile. Is there a normal number? Is it low? Do they look normal or do they look abnormal, the morphology? The motility, do they move as they should, or is the movement reduced? Those are the parameters that are being checked up till now from that perspective, but not in any way can the sperm actually bind to the egg cell, which is required for the fertilization to happen. Now, let's take a look at Juno checked. We're actually checking if there is a binding to be measured. Now, let's halt here and let me explain a little bit about this, how this works. If you see this round body here, you see it's the egg cell, right? And around the egg cell, there's this yellow layer that's actually a protein layer called zona pellucida, been known for years. The sperm approaches zona pellucida, binds to and actually penetrates through the layer. It's an outer layer, not in contact but surrounding the egg cell. Inside, and it's passed through zona pellucida, the next thing is for the sperm's izumo-1 receptor, as it's called, to bind, as you can see on the lower part of this rectangular drawing, locking in and binding to the Juno protein on the membrane of the egg cell. So the Juno protein, totally unique, found in 2018 in human egg cells, was unknown before. And this to use a biosensor for measuring the binding capacity or the function of sperm to Juno is what we have patented, and that is unique. And we have received a patent already in Europe, which will be shown where precisely, if you will. Now, how is it used? Now, we have so-called biosensors. They are, like, say, a body where there is a ceramic bottom, there's a gold particles, and there is a recombinantly produced zona pellucida protein on one of the chips and recombinantly produced Juno protein on the other chip, okay? Sperm samples is applied to each into our reader, and within 30 minutes, there's a reading if there's a binding or not. Simple, unique, totally new, and not been possible in any shape or form before. So the biosensors for sperm fertilization potential is what we're actually having here. So going through zona pellucida gets hard and hardens, so no more sperms can come through, and then binding to Juno, if there is a binding. So that's how it actually works. Now, Juno check, the product, will it have any meaning really? Yes, it will. It's expected to reduce the psychological stress on couples with infertility problems due to shortening the process. Shortening meaning we assume there will be less cycles to achieve fertilization. Is expected to reduce the number of hormonal treatments for the female patient, often associated with acute and chronic side effects. Less hormonal treatments. Is expected to facilitate more couples to get treatment faster at IVF clinics and getting pregnant faster. Now this has relevance because there's a large number of patients, couples, waiting in line for years to get treatment. So getting treatment faster will not mean that the clinics have less to do. They'll have plenty to do because there will be more patients coming in, getting treatment quicker, and being happy moving forward. So it's also, of course, expected to reduce the cost per couple by reducing the number of IVF cycles or IVF iterations. Now, when it comes to reimbursement, I can mention that globally, about 60% of all IVF treatments are reimbursed in one shape or the other. So in 2020, of the $20.5 billion US dollar, which the IVF market encompassed, 60.5% was reimbursed. And also expected to improve the profitability for the IVF clinic by offering IVF treatments to more patients at a premium price. Now, the second part of this presentation is what are our long-term ambitions and goals? So, for 2021, research and development and regulatory, we're going to finalize the development of Juno checked. The goal is that to start and continue validation tests of Juno checked, to secure patent protection on key markets. The EU patent is already granted. We're now in the national validation state in the countries we have sought such for. The applying process for Juno check's CE mark will be initiated this year also, as we have said also in our memorandum. And market project plans in preparation of the market introduction. Now, look at 2022. Let's look at that year as the go-to-market year. We'll finalize a CE mark for Juno checked. We will establish distribution channels on our target market, and we will develop the go-to-market organization accordingly to support us going to the market. We will market launch in Sweden, in Denmark, and in Norway. That's our, let's say, home market, if you will. 2023, the expansion. Well, we'll start the expansion of Juno checked outside of Europe. The US is intended, and other markets as well. Start the development of Spermosens' second product, Juno picked, which is an amazing development when it comes, where it will be possible to choose the appropriate sperm for using in the alternative ICSI technique, to choose the right sperm for injecting into the oocyte with a micromanipulator. Quite amazing, actually. So Juno checked for measuring if there is a binding capacity. If there is, go to Juno, the natural standard IVF treatment. If there's no binding, go to ICSI and be able then, at that point, by using Juno picked to pick the right sperm, is simply amazing. So, what's the market potential for Juno check? Well, if all clinics in the world use Juno checked, the target market we have is 3,600 IVF clinics around the world. Of these, we have 1,000 in Europe. 5 billion Swedish crowns per year is the potential if everybody would use it. Will that happen? For sure not, but I'm convinced that a majority will. A large part of the market will be captured because there is no alternative. And our goal, Spermacens' goal, is really to be established as global market leaders within male infertility, diagnostics, and treatment. So, what we've done also during the first 6 months, we have started and announced an advisory board with members from Sweden, Norway, and Denmark. Now, why did we do that? We did that to secure a regular and constant input of scientific input from what's going on the market and clinical input. Input into the organization of Spermosens to be then transferred in parts, as it is, to the development of the products. The advisory board is not intended to be a direct connection to the development of the products, but will influence and make us understand how the market works, and not least trends that are occurring on the market. We have Professor Alexander Werkman, Lund University. We have Professor Trine B. Haugen from Oslo Metropolitan University. We have Amy Henich, Associate Professor from Lund University, and of course Klaus Yding Andersen from the University of Copenhagen. We're very proud to have these distinguished researchers and clinicians on our advisory board. So, what's occurred during the first 6 months of 2021? Now let's see, before we go further there, we did put out things in our memorandum that we were supposed to do, and we have up till now upheld that absolutely, 100%. So the development of Juno Check, the instrument, the reader, and the cassettes is ongoing, and is ongoing, as you see the picture to the left, is at a development partner we have, called Zimmer & Peacock. They're in Norway, they're also in the UK and other parts of the world actually, but we are collaborating mostly with them in Norway. And the industrial design of our device is being developed by a great company also in Stockholm called Myra Industrial Design. So the development is moving forward according to plan, I'm happy to say. We're also doing clinical assay optimization with volunteer semen samples at Oslo Metropolitan University, which so far are going well. When it comes to clinical tests, we have to ensure that they're done in a very professional way. We have therefore engaged a very renowned company called Medid, who will oversee that the clinical tests are done according to protocol and that the data is analyzed and presented in the right way, to say it in a summarial way. It's very important that we have this quality assurance to make sure that everything is done 100% correct. Now, the patent status is, you look at this more or less world map, you see the greenish color there is like Europe, or the European patent area, which actually consists of 38 countries. However, we are now going into the national validation phase in 16 countries. Actually, that's where we will have the full patent, in these 16 main countries in the European area. And parallel with that, patent is pending in 11 other major markets around the world: North America, parts of South America, Asia, and so on, Australia, and New Zealand. So we are now in the so-called priority year. So we're very happy, in a very good place. So we did receive the EU patent the 11th of August. And we have 3 months now to fulfill the national validation, which is ongoing for all these 16 countries, and is being done, and countries are being validated one by one, and will be done before the 11th of November, within a 3-month period. We are then secured for the next, basically, 20 years. Well, that came to the end of my presentation. I'd like to say thank you for listening, and welcome with questions and comments. I'll do my best to reply as best I can.
Well, good to have you back, and interesting presentation, and of course also the field that you're working in is, I know, very important for many people. So I'm sure that people would find that interesting as well. Can you explain to me the Juno Checked journey, so to speak? How far are you, and when will that, when will the product be completed? Will that reach market this year or next year?
No.
Or?
As we've stated in our memorandum, we will finalize the development of the device this year. We'll have a finished prototype, a functioning prototype this year for the product. The tests for the CE mark application will commence soon, in a month or two, and continue this year out and possibly part into the next year. The commercial on-start will be next year.
Okay.
And exactly when next year we cannot say, because as it also says in the memorandum, the CE mark application can take 7 to 11 months, give or take. So we're a little bit depending on those times. But during next year, we will reach the market.
Okay, so that's the plan, and that's what you're aiming for. Is there tests going on right now with couples, with the university or related?
No, not really. I mean, as I mentioned, the sperm volunteer samples for optimizing the assay, actually the Biosensors, is ongoing. Has been done, is ongoing at Oslo Metropolitan University.
Okay.
Clinical tests overseen by Medid, this company, will be starting in a month or two, which are related to the CE mark application. Now, tests and clinical tests is an ongoing thing which will go on as you move away from the regulatory requirements. We'll have the go-to-market requirements, if you will.
Yes, yes.
And they will have the requirements to give evidence-based results for the actual results of it. So, in short, we're in a very good place regarding our development at this time. We're not lacking or sagging in any part right now, not yet at least.
But still, one have to understand that being a medtech company, it's a rather long journey that you have to sort of to pass quite many tests before you reach the consumer market, so to speak.
You can say that. That's absolutely true. But bearing in mind that the company was started in 2018, we're public this year, next year we're going to the market. It's going quick. But it's also based on this amazing technology and the work that's been done mainly by our co-founder, Kush Punyani, who's behind this product to a large extent and developing it as we speak. So we're very happy to have his expertise.
And he's with the company still, and he's so to speak, the brain of the of development, of course.
Well,
not
only I can say that we have a technical affairs manager who is a electrochemist and biologist. We have a scientific lead. We have a quality assurance regulatory manager. So we have other people, but of course, Kush is at this point the CSO, Chief Scientific Officer, and of course, leading the development, where I then bring it forward into the preparatory and actually go to market, where we'll use this amazing opportunity in the best possible way, actually.
So if we look at then, I mean, the opportunities are there, but what about the key risks if we look at your journey in the next 6 to 12 months? Technology risks, I assume, are there, and market risk. But can you put some word on what we should know as investors?
Well, you should know, like everybody should know, as it says in the memorandum, there are always risks with startup companies. Regardless if it goes well to now, things can happen. Development risks could be there. We don't see anything at this point. Market risks could be there. The world could change in different ways. We don't know that. So are there risks? Absolutely. Do we see any serious risks at this time? No, we don't. But there are risks. And anybody who invests should know that. However, investors so far have had a pretty good journey where we've gone up forward, because I think it's because the case is so strong, and I think we've shown that we have been able to deliver what we've promised so far. So
competition in this field is more, it's not head-to-head competition. Or are there any competitors trying to do the same as you?
I don't know if there's anybody trying to, but they'll have a problem, as we have a patent for using the Juno protein for sperm assessment. Okay. There is no competition to this. There is no other company that does anything like us. There are other diagnostic systems, of course. There are different ones.
But as I also asked you before, in this fertility treatment world, I guess there is high margins. So could it be that somebody say, hey, we don't want this, we don't want to optimize this process, we want to make money on what we already have, so that you meet some competition or some, you know, some, some people that don't want to use your problems for various reasons?
Well, you know what? If there wasn't for the fact that an estimated 6 to 10 million couples are waiting in line for 1 to 3 years to get treatment, I would say maybe yes. Bearing in mind that there is an underserved market, gravely underserved market, and the fact that the female patient and the couple suffer so much from these procedures, if they can reduce even one cycle, even one treatment, will be beneficial, which will also pen down to the clinics being able to offer, let's say, a better treatment regimen, faster and quicker results, and ultimately, we would assume, be able to profit from that by a premium price for a premium service offered, if you will.
Okay, so that should overcome potential, of course.
Well, there will always be people who are using the old and they want to continue the use of the old, and they can continue to use the old. We will not convince everybody at once, but we do see that if we can prove the X percentage of higher outcome using our product, I do believe that it will be very few who can refuse using it, if you will.
Would that be Scandinavian to begin with, or would you go out on various markets?
Well, it's like this. We're going to start in Sweden, Denmark, Norway, but I believe we will be very quickly approached by different parties. And as we can manage to serve these different countries, we will go in. But Europe first. Europe first. Okay. We see us going into the North American market in 2023. Yeah. We see us developing our next product starting in 2023 also.
And the next
Juno picked.
Yeah, Juno picked would be the next. Is it true that of being the next product there would also be a little bit more uncertainty around Juno picked?
I would say the contrary. If we have proven the efficacy of Juno checked, it's basically the same function where the ability of the sperm to bind to the oocyte is measured. With other words, improving the workflow, improving, assumably, reducing the number of cycles. Remember, each cycle costs an average of, let's say it would be equivalent to 42,000 Danish crowns, I expect, for every treatment. I think of that 40,000, about 10,000 would be drugs and 30,000 to the clinic. So if possible, to reduce the number of cycles and the use of drugs associated, it will also influence the cost expenditure for the public involvement here.
Okay, so in that sense, of course, the next 6-12 months, also on the technical, will be, the technical side will be very important, of course. And then you say if you overcome some of the obstacles on the journey in the next 6-12 months, that will of course also help you in the long run.
Well, let's say like this. We have basically a product which we believe is working. We're now optimizing it. It's not that we're developing the product further to get a new product, if you will. No. We have the base, the fundament for Juno checked. The reader, the cassettes with the 2 biosensors, you remember, one with zona pellucida and one with Juno, recombinantly produced, right? Yeah. So, yes, we will have to validate. We'll have to ensure that it works in all different manners. That will be ensured by doing the clinical testings for the CE mark, which is one thing, the regulatory aspect, the clinical test needed for the go-to-market aspect also. So, all in all, we are in a good place. So it's not that we are inventing, that we have a lot of totally unknown, that we don't know how the cassette's going to work, basically. We do basically do that, but we have to verify, we have to finalize the studies. As we move forward, we'll do so, but we are at this time in a good place. So I do see it as really feasible that we will reach the market next year.
And that leads me to the next question about the first revenue streams that you expect. When is that the same answer that would be sometimes in 22?
Absolutely.
Yeah.
The first revenue will be during 2022.
Okay.
Yes.
Would that be from a public entity that buys something from you, or do you expect it to be private clinicals, just to understand who
I can't say that.
No. Okay.
I mean, you see, there's a private sector, there's a public sector.
Yeah.
They both would potentially benefit from this technology and these products. We cannot foresee how they will in reality react when they use the product. We intend, hopefully at the end of this year, beginning of next year, put some of these products in the hands after protocol with some clinics to see how it works in their hands, right? And based on that, we'll also get evidence to move forward or make possible adjustments as it would be needed. Now, it's not only a question of how the product works, it's also a question how this works in the clinic's workflow. How do we get this in the right way so people see this as beneficial? How do we make it a good addition to them and not an obstacle in any shape or form? Possible to do, but require that we put thought to that and don't think because we have a world-unique product coming, it's going to sell itself. Doesn't happen that way, but we will make it happen doing it in a professional way by educating the clinics on how to use the reader and how to use and store the cassettes.
If it was easy, I guess that somebody would have done it before. So of course you need to to have some skills to go there. Talking about the money, and I hear that you have recently changed your CFO, a new guy, a wingman to you.
A great wingman. I mean,
financial officer.
Yeah, CFO Ulrik Nielsen, amazing guy with a world of experience, really. Among other things, been the financial director for Baxter Gambro, involved in setting up and maintaining facilities and affiliates around the world. So far beyond the traditional CFO work, a sparring partner with me and knowledgeable in so many ways. I'm very happy to have Ulrik on board on the management team, which in addition to Ulrik and me also, of course, is Kush. Kush Punyani, who is also on the board.
Before we go to him, why did you have to change your CFO? Was it?
Well, we had didn't have a full-time CFO. That's one aspect of it. And we needed a full-time CFO. That's the second fact. We happened then in our search find a highly qualified candidate who could fit the role of taking on a full-time employment, which he did September 1st, and since it took about 5 minutes before we clicked and went going in a wonderful way where he kind of saw different things to maybe improve, maybe facilitate, and that's what experience gives you.
Yeah, of course.
That's what experience gives you.
So that's part of the building the long-term team.
That's right.
Yeah, and with also, of course, also with your partner and the founder of the company being on board as well.
Yeah.
If we talk about when or the journey and funding the journey, I know there's a small little detail about bringing in more money because you have a planned round next year.
Yeah.
Can you put a little?
Well, it's not a small part; it's an important part.
Yeah.
But actually, it's part of the offerings we had when we were listed. We had these so-called units, consisting of 1 share and 1 warrant. The warrant will be possible to subscribe to in May next year. So we will then get an influx of capital, which will take us further on into the market.
Okay, so that's part of the plan to make another funding in May next year.
Yeah, it was already part of the plan when we went public. So those who subscribed then got the extra benefit of the tier 1.
Yeah.
So that tier 1 will be offered at 70% of the average share price 3 weeks before the first subscription date, I should say. I stumble on the words here.
But great, but I think that actually led us to, or at least maybe near to the end of this small meeting. It was good to see you here, but can you just put a few words on the next, I mean, when do we hear from you again, and what would be the next 6 to 12 months journey for you? and maybe also give a little word to the investors what they have to look for for the next 6-12 months.
Okay. What we have to do now for the next 6-12 months is obviously to finalize the development of the product, get the CE mark application underway and finalized if so be, and get to the market next year. So take a look at us delivering the device, inform you about that, that we inform you that we have now, let's say, started the CE mark application with the clinical tests, and see that we also eventually then get the CE mark during next year. And of course, when we announce our partnerships with distributors and announce the structure of our go-to-market team, which will be very structured, dedicated, working in a sequence where we'll have customer service, clinical IVF product specialists working in team towards the customers, and with the backing of the company in other ways, product management-wise and so on.
So there's a little, there's some things to look into for the investors, and I'll switch back to Danish, Danish-Swedish, just to end this presentation. Jeg håber, I er blevet klogere på Spermosens derude. En for nylig IPO fra svenske Spotlight, som jo så har været på børsen nu her i snart et halvt års tid, og er kommet med et nyligt halvårsregnskab. Så John, tusind tak, fordi du kom ind og besøgte os.
Tak for, at jeg fik komme her.
Jamen, og skulle I have nogle spørgsmål, så kan I skrive, så skal vi nok lige lægge, Johns e-mailadresse ude i der, hvor I kan se filmen, og så kan I også kontakte selskabet direkte via deres hjemmeside. Så tusind tak for nu.
Tak så mycket.
Kom godt tilbage til Lund. Glæder mig til at ses igen.
Tak så mycket. Tak.